Sonora Regional Medical Center is proud to offer a comprehensive joint replacement program in the beautiful Sierra Nevada foothills.
And so I think a very successful joint replacement program is focused on a consistent, integrated program with the same message coming from the same people day in and day out.
Each person delivering care for our joint replacement patients has undergone specific training, enabling him or her to provide the most effective care and anticipate the needs of each patient. Our staff of surgeons, anesthesiologists, nurses, physical and occupational therapists, dietitians, and pharmacists is dedicated to providing an excellent experience when making sure your surgery is successful and without complication.
Life before hip surgery was very painful.
Miserable. It really was.
Yeah.
Yeah, it was. I was so uncomfortable.
Almost every step was like, do I have to take another one? Because it was so painful.
Our lives were really locked in the house, really. We couldn't go outside, we couldn't work in our garden. We couldn't square dance anymore.
Yes.
We had to stop square dancing, which really hurt a lot because we love it. And that kind of pain just takes everything out of you. Tired, really tired all the time from fighting the pain.
Timing for joint replacement is an individual decision that you discuss with your doctor, and it's different for everybody. This timing is when all non-surgical treatments have failed and you're having more bad days than good days and you can't do the fun things in life. When that happens, I think it's time to start thinking about a joint replacement and talk to your surgeon.
We understand that surgery can create a lot of anxiety for patients. That's why we have developed a robust program of pre-surgery education, which includes a detailed manual with information specific to your surgery on what to expect before, during, and after the procedure.
The process of replacing a person's joint that's worn out or arthritic is a very complex process. It's not just a surgical procedure, but it also includes a team of people. The most important member of that team is the patient that's undergoing the surgery. And for them to have extensive education and training before the surgical procedure helps dramatically in reducing their stress level and their anxiety level about going through the procedure.
We offer a weekly joint replacement education class because we have found that well-prepared patients with well-prepared family members and other support people often have the best experience with less anxiety and easier recovery.
The whole team approach to joint replacement is not just surgeon and their desires and their technique in the OR or their approach in the OR, but it really encompasses whole person care, it encompasses the whole person's family, and so that we can try to make the patient feel more comfortable.
I got terrific care. From the moment I woke up, I was in my room when I woke up. The nurses were very, very attentive. It seemed like the nurses were there before I needed them even. It was really good care.
I think Sonora is an unusual facility. Many people feel that for a procedure of the magnitude of a total joint arthroplasty that they need to go to a center in a larger community or to a university. Whereas that might be true for some unusual procedures, and where it might be true in some communities, I don't think it's true in Sonora. We have physicians and a process that is equivalent to anything anywhere, and it's right here at home.
Our second floor has been designed specifically for joint replacement patients. Hard surface floors have markers every 10 feet, goals for patients to walk to as they begin rehabilitation the day after surgery. And artwork displayed throughout the hallways illustrate special exercises for joint replacement patients to follow. Private and semi-private rooms are decorated in soothing tones to promote healing with artwork that inspires recovery. Special measures are taken to ensure patients are comfortable and ready to participate in rehabilitation the day after surgery. Changes in the approach to post-surgical pain, utilizing multiple pain management techniques, have patients able to start therapy earlier with minimal pain.
I can remember when I was a resident, not too long ago, going and seeing or rounding on our patients after a knee replacement was difficult because these patients were in a lot of pain and they weren't happy, and it was tough to get them up and get them moving around. And that's not the case anymore. The last few months especially, when I see my patients after total knee replacements, I mean, I'm really shocked because it's vastly different than how it was even 5, 6, 10 years ago.
On the day of surgery, patients sit at the edge of their bed and they dangle their foot, which means their leg and their foot is down toward the floor, which is significant for total knees because they still have a block and they can see how good their knee moves. And all that helps significantly in getting your range and your confidence back soon.
Oh, yeah. Oh, it was the best thing in this world. Oh, I was so happy. Oh, the excitement, the feeling of no more pain, the feeling of euphoria. Oh, it was beautiful. Oh.
Pretty much the first thing you notice when you come out of your anesthesia is, I don't have that pain anymore. I've been miraculously cured.
Reborn.
You got the other pain from the incision stuff, but you know, it's like being reborn, starting life over again.
Yes. It's true. It's true. I was outside walking. As soon as I got home, I was out with my walker walking in the driveway. So I'm just out working in my garden. My poor garden had to be let go for 3 years because my hip was so bad before surgery. And I'm out there working again and raking and digging and planting and having an absolute ball. And we're now planning to go camping, starting our camping again. And we're also looking forward to getting back to square dancing, huh?
Oh, yeah.
Yeah.
Hope to.
Yeah. That's really something that's important to us, is square dancing.
Don't let joint pain keep you from the activities you enjoy. For more information, visit our website, sonorajointreplacement.org, and call the Center for Joint Replacement today at 209-536-3366 for a referral to one of our orthopedic surgeons. Get your life back.